The community sector in Ireland has grown substantially over the last numbers of 2 decades, to the point now that almost 50,000 people, it's estimated, are working in the sector. And when we talk about the community sector, we mean thousands of local projects that employ full-time workers or part-time workers right throughout the country, and particularly in the more disadvantaged or poor areas. Many of the working class areas in the past were abandoned by many of the public services or activities, and it is in those circumstances that many of the community sector type organisations emerged. In other words, where there was a drugs crisis, it was community-based organisations, local residents, that formed groups that began to deal with it. And what we've seen now over the last 20 years has been a rapid expansion. As the state itself and government departments have withdrawn from some of those areas, the vacuum has been filled by essential services being delivered through community-based organisations. And within the sector itself, there's a whole vast range of different types of services and activities being provided, whether it's in the area of disability, the area of addiction, the area of childcare, elder care, etc. And within those, we've got a whole range of types of services and jobs and skills and capacities that have developed. One thing, though, however, that isn't generally recognised is that these jobs are equivalent to what are in the public or private sector. The same types of jobs, just delivered differently and in a different location and under a different type of management. And it's this issue that we want to also bring to the fore, because in terms of linking with the unions, other workers in different sectors, it's important that they recognise that this diversity exists, and that this whole range of jobs are being provided and services are being provided by workers who not only deserve the recognition for the work they do and the value of the work they do, but that they should be treated in the same way as workers operating in the more mainstream sectors, whether it be private or public. One of the significant challenges we're facing at the moment is the issue of the private sector effectively, or the market, being assumed as the solution to many of these problems. Now, of course, where the state itself or the public sector itself is not operating at a local level or not operating at a national level in issues such as homelessness or the drugs issue, that doesn't mean that the private sector or the market can determine what does happen. In fact, there's a greater need than ever for community-based organisations doing what they're doing, because we now know, as the state has retrenched in terms of its services, that the profit element of it is not going to entice market forces to move into those areas and provide quality services. So there's a stronger argument than ever as to why public funds that are the public's money should go into public services delivered locally by local people and local services, and challenge the thinking that assumes that somehow or other you can either privatise this, contract out this sort of work, or worse than that, leave it to market forces itself to respond to some of the most acute needs, such as homelessness, drug addiction, childcare, that are happening at a local level. That isn't a solution, but unfortunately there's an ideology abroad now that somehow or other the state can abandon it, but the private sector should be allowed to take it up, and we're not going to accept that. Having said that, I think there is a recognition slowly from some of the statutory agencies that this work complements what they're doing, whether that's local authorities, the HSE, the health services. Many of them are actually beginning to recognise that they can't do that work themselves, and that in fact they're better off working through, negotiating with or contracting local organisations to do it. However, that brings us to the crunch. If people locally are expected to do this work, they should be paid properly for it. They should be able to sustain the work that they have, get security in the work, and get pensions and other rights and entitlements that other workers in the public sector have enjoyed for many years. So one of the issues now is to get that recognition, not just by government departments and agencies and the government itself, but by other people in the unions, by other sectors in society, that this is a legitimate activity, it is a worthwhile activity, and in fact in economic terms is contributing significant amounts of money in terms of the savings that are made by this type of work. A lot of the work in the drugs area or in the elder care or in childcare are preventative sort of activities that allow the state itself to save substantial amounts of money. However, what we don't want to see is that they are seen as a cheap option that can be with the minimum of resources, and that therefore the savings are purely at the expense of the workers involved themselves. And that to us is one of the crucial issues now. Proper recognition, proper wages and conditions, and proper long-term sustainable funding that allows these services to continue.
Sisters, together we will stand. There is power